All right. Hello, my name is Taylor. I'm going to be your nurse today.
Hi.
First, I'm going to wash my hands, provide privacy, and verify doctor's orders. So today, I'm going to be doing a full head-to-toe assessment on you. Can I verify your name and date of birth?
DeMarcus Davis, April 20, 1990.
Okay. All right. So I verified the orders, verified him. Okay. So we're going to go ahead and start with your head. So have you had any like headaches recently or any like throbbing pain?
No.
No? Okay. And so I'm seeing that his head is normal cephalic. It's no like abnormal swelling. His hair, we'll go ahead and do the grooming as well. So his hair is well groomed. There's no like abnormal denting or anything like that. Trying to see. All right, I'll go ahead. So your ears, have you had any difficulty with like hearing or no? Okay. And I don't see any like drainage or any earwax protruding out. And they're both midline to the nose, so they both line up very well. They're both intact. There's not one, like one doesn't droop lower than the other. And can you hear this?
Mm-hmm.
Okay. And then what about this?
Yeah.
Okay, so he responded to that very well. And then eyes, we're gonna go ahead and do your eyes. So I see that you wear glasses. Do you have any trouble with vision as far as like with the glasses on?
No.
Okay, so you wear them. Do you wear them every day?
Mm-hmm.
Yes. Okay. So his inside of his eyes look normal. White. There's no like yellowish coloring. And he is following me with his eyes, so he is reactive, I would say. I'm gonna do the. Forgot the name of it again. But stop. I'll think about it. Okay. Accommodation. There we go. Accommodation test. So just follow my finger for me. Go back. Go to the side. Good. And over to the other side. There we go. All right. So yeah, he followed my finger well. He did really good with that. And I'm gonna go ahead and just assess his pupils. If you'll take your glasses off for me. Okay. And just look at me. Okay. All right. So yeah, they were both.
Hey, how are you?
Hey.
How's school going?
Going great.
So both of his pupils were both bilaterally equal. They did constrict when responding. They did respond to light. All right, so moving on to the nose. His nose is midline. It is intact. Have you had any issues with like your sinuses or difficulty breathing?
Normally in the springtime, I do have some sinus
In the
issues.
spring. Are you experiencing any right now?
Not right now.
Good. Okay. And it looks.
Any boogers?
There's no drainage, abnormal. There's no boogers present. I'm gonna
I got some hairs on my
Okay, that's fine. All right, so breathe in, blow out. Okay. Okay, so good patency. Let's see, and everything looks intact. It feels his skin feels pretty good right there. I'm gonna check for now. I'm gonna check your mouth out. So.
Oh man, this got finished with lunch.
Excuse my patient.
My breath probably smelled from some lunch, but
So his mouth is moist. I'm gonna check back there. Yeah, it's moist. No teeth decaying. No abnormal findings in your mouth. It's pink. Trying to think. Oh yeah. So have you had any trouble swallowing or
No. Can I get a cup of water?
can you get some water after this? Yeah, of course. Of course. All right. Oh my gosh. All right, so I'm just gonna check to make sure. Can you swallow for me? I'm sorry. Okay. Is it
Swallow.
good?
Okay,
Yeah.
let me see.
Okay,
There we
good.
go.
Perfect. Okay.
Mm.
All right, and then I'm gonna go ahead and check your neck for JVD. So just turn that way for me. Perfect. Nothing protruding. We'll check this way. Okay, good. All right, so no JVD noted. All right, so I'm gonna go ahead and do the cardiac and respiratory. Okay. All right. So have you had any like difficulty breathing recently? No? Okay. And I'm gonna go ahead and listen to your lung sounds and do cardiac as well.
All right.
All right, so right here. Deep breath. Okay, and check your side. Check your other side. All right, I'm gonna do your back. All right, and then I'm gonna go ahead and listen for the cardiac, do the cardiac assessment as well. So, right side. And this is the aortic valve. I'm gonna move over to the pulmonary valve. And then to Erb's point. And then the tricuspid valve.
I need to lift my breast or anything?
Hmm?
I need to lift my breast out the way?
Right here. And then the mitral valve. Okay.
All right.
And then if I were to hear anything abnormal, I would check for murmurs with my bell. So yeah, your lung sounds were clear. I didn't hear any abnormal cardiac noises. I heard it. All your lobes sounded clear as well. So we're gonna, while we're still in respiratory, I'm gonna go over the coughing and deep breathing. So I know you said you haven't had any trouble breathing or difficulty breathing, but I'm going to give you this incentive spirometer. Okay.
All right.
So this is in case you. Anyways, this is in case you are like having trouble breathing. It'll help kind of get your lungs working, back moving, expanding, and constricting and expanding. So what you'll do is you'll, instead of like blowing into it,
Yeah, that's right.
you inhale.
Mhm.
Okay, I want to make sure I didn't have the back first. So you'll inhale, and I would say do it, try to do it like 10 times an hour. So do it on your commercial breaks. Try to just go ahead and get that in, and use it whenever you need it, okay?
It looks like a toy. Is it really going to help me?
It will really help you, I
Okay.
promise. Yeah, it's going to do what it needs to do. You have any questions about it?
No, I think I got it.
Okay.
I'm supposed to do it all at once?
No, you, so do it in like separate increments, but do it over an hour.
Okay.
Yeah, so.
I think I'm good then.
Yeah. Don't wear yourself out. Don't do that. All right, so endocrine. We're going to go ahead and assess all that. So we already went over like grooming, the hair, skin, nails. Hair, I said he looks good and groomed. His skin is it's appropriate for his ethnicity. There's no like blotching, there's no like discoloration. It all looks even. His skin looks very clear, very clean. Nails. Alright, and your nails look nice and groomed. They're cut very nice. You don't bite your nails. Good job.
Not at all.
Let's see. Abdomen and GI. Have you been having any stomach pain recently?
No.
Or no? Okay.
I had some lunch
cramping? Okay.
Yeah.
Okay. All right. And I would check for like any distension or like abnormality, like where if it's like not flat, if it's like protruding in, or I forgot what that keyword was. But trying to think. I will listen for his bowel sounds.
Want me to lift my shirt up? Want me to lift my shirt up?
Hey, mother. Okay. And then I would listen right here for the abdominal aorta. What? Oh, with the bell. Oh, that's right, because it's a murmur. That's right. So I would listen with the bell for the abdominal aorta. And I'm going to just kind of feel on it, make sure that it's good, that doesn't hurt or anything, right? No?
No.
Okay, just making sure. You gotta, let me know. All right, so, oh, that's right. Have you had a bowel movement recently?
Yes, this morning.
Okay, and then what about when's the last time you urinated?
I had some difficulty letting it out.
You had some difficulty?
Yeah.
Did you get it out then?
I got it all out.
Okay. You were struggling though?
Yeah.
Was it painful?
No, it wasn't painful, but I think it might be my prostate or
You
something.
think so?
Yeah,
You might need to get that checked out. We'll have to look into that. Okay. So the whole time that I've been assessing him, he is awake, alert, oriented. So I would say like a GCS of 15. We can go ahead and knock that out. And level of consciousness, he that's the one where it's like awake and alert. Times 4, right? Yeah. So times 4. He's very alert. He responds appropriately. And you haven't hit your head or had any type of injuries recently, have you? No? Okay, good. All right, and then lastly, we're just gonna check the range of motion in your gait. Let's see. All right, I'm gonna do what are your wrists? Both your wrists. All right, so if you'll just do it like this. So if you'll go like this, so he's extending it, and then flexing it, good. And then push down. All right, push up. There we go. So good. He had equal resistance in both hands, and the strength was good. He was able to flex it, extend it, and hyperextend it, which is good. And then I'll do. Which one did you do for your video?
Elbows, knees, and ankles.
Okay, I'll do your elbows too. All right, so we're gonna extend it, flex it. That's it. You can't hyperextend it, so that's good. All right, so push up, and then push down. There we go. And same for those as well. Both strength is equal and even. Resistance is good. You said you did your ankles.
Knees and ankles.
Knees and ankles. Okay. They can see me, but All right, so you straighten it out, both of them, and then flex them, extend them. All right, and then push up. Okay, and then push down. Okay, good. And then we'll do your I'll really do your feet. I think I like that better. Well, no. Okay, we'll do your ankles. So you want to flex them, and then extend, hyperextend. Okay, and then push back, and then push forward. All right, good. So yeah, his range of motion is really good. His strength was equal for each one, and his resistance was good. We're gonna go ahead and check your gait real quick. I just want to see how well you walk. Let's see. Okay. All right. So if you'll just, there we go. Good job. Can you turn around? Good job. So his gait is steady. He has a good balance. We're gonna do the, is it the wrong leg test? Okay. We're gonna stand right here and I'm gonna just hold him. You can close your eyes for 30 seconds. Make sure you better stop. Do not do that. And then making sure he doesn't fall. And he's standing very still. He's cheating. All right, we're good. All right, thank you. You were such a great patient. Oh, it's fine. Okay, so I did forget to assess his pulse, so we'll do that now. I'm gonna check both of his pulses. Make sure they're.
She just went over a lot of bowls. That was like the majority of it.
Okay, yeah. So they're both bilaterally even. I would say like a +2. They're not too strong, but they're pretty good. Your feet. All right. Thank you.